Welcome back. We're talking about sinus issues, and with us today is Dr. Frederick Lopatin, who is an otolaryngologist with offices in Dearborn. Dr. Lopatin, from what you've explained, it sounds like the sinuses are a filtration system, air and a drainage system. Do I have that right?
Kind of. Basically what the sinuses are doing is there's lining to the sinuses, and the lining has this layer of like a jelly layer that traps things as it comes into your nose.
Impurities and things like that?
Impurities, things in the air that will get trapped in there. And then the sinuses, what they will do is they will catch those things and they'll put them into mucus. And that's where mucus is produced, inside these lining.
And when we blow our nose, out it goes?
Correct.
Okay.
A lot of times it actually goes down and goes into your stomach, and that's the way it's supposed to happen. What happens with sinusitis is that drainage pathway gets blocked, whether it just swells so that the mucus can't come out of where the sinus drains, whether it's in polyps that block it. That's when you start to get into trouble. That's when you start to have pressure. That's when you start to have pain. That's when you can start to get fevers and other things.
Now, is that when you go immediately to surgery, or are there some steps prior to surgery?
Well, prior to surgery, we always want to use conservative care. Conservative care would be basically, that's why we use antibiotics to cut if we believe it's bacterial that's causing the swelling. If it's allergies, we use antihistamines. Sometimes we do allergy shots. We also will use steroids. Steroids will cut down the swelling to help open that area. One of the other great things is saline. I'm sure you've heard about hypertonic saline or salt water, putting it up your nose.
Yes, I have. Yeah, I've heard about it.
It works great, and it's pretty easy, actually.
And is that going to eliminate the infection? Is that what that's for?
Well, not exactly. It can help get the impurities. What you're trying to do is it's a natural decongestant. It will help open that space. It will clean out some of those impurities so that you don't get the infection. The infection is more usually caused because that drainage pathway gets blocked.
Ah, the block drain. That's
the key.
That's the key to the sinus issues. And that's when, if the medical treatments and the saline solutions don't work, that's when you go to surgery.
Correct.
And you've brought some things to show our viewers about what surgery may be like. What have you got here?
Well, we have some balloon treatments. These are some of the latest things that we're using, and that's really just a balloon, and it was actually used in angioplasty. It's an angioplasty balloon.
I know the angioplasty balloons open something blocked. So these blocked sinuses get opened by this. And how does that work?
What we will do is, this will happen in surgery when someone's asleep so they're not feeling it.
Great.
We will put it up into their nose, and right now what we're using it a lot for is the frontal sinus. That's the sinus in your forehead. That's when you have that pressure up there, and if that's blocked, we'll put it up in there, and as you can see, then we'll slide the balloon. That's a little guide that we use.
And all these sinuses are connected to each other, right? Everything, even leading to ears, right?
Well, the ears, the back is the eustachian tube that leads to the ears. That's in the back here.
But there's a pathway and a connection for everything.
So everything kind of drains back. If you see there, that's the middle turbinate. Just inside there, right where I have that balloon, you'll see there it will drain right down there, and that's when it can mess with your ears. That's where the eustachian tube, you have that thick drainage. If the drainage gets too thick, that's when it will get there. And it gets thick when it's blocked. Mm-hmm. You don't get as much aeration in your sinuses. Then that mucus gets really, really thick. And when it gets real thick, that's when you start to have problems. When it gets so thick it won't come out, and we can't get it out with steroids, we can't get it out with decongestants, that's when we talk about surgery. This is one of the ways we do it, and then we can put the balloon up there. We can actually blow up the balloon, and you see we can just by pushing the balloon.
Now, how long does this procedure take? How long a surgery would it be?
Well, depending. If you're just doing something like you just have to open up a sinus in a balloon, it's probably about a half an hour. Mm-hmm. Usually more people have other things that we have to do first, because getting to this point where we're going to put the balloon, there's usually a blocked area. And we use 3D image guided a lot of times to do that. So we put the patient to sleep. We put an instrument on their head that kind of looks like a little metal antenna. And that antenna goes to something in the ceiling, above from a machine, and that now will correlate to a computer.
Did you bring us a little example of that? I'd love to see it.
As you can see here, this is a view of an endoscopic. That's actually inside the nose, an actual picture. These other pictures are our 3D image guided. As you see, there's crosshairs. That shows exactly where the tip of that instrument is.
Oh, is that instrument similar?
We don't have that instrument here. That instrument actually is, it's more like the guidance instrument what we have here, except it's straight, so it just kind of stops about there.
So you're doing quite a number of things to open up the drainage. And let's talk about after surgery. What's the recovery like?
Well, after surgery, one of the things, people used to be scared and they talk about all this packing we used to use and throw in 6 feet of packing. We don't do that anymore. A lot of times what we'll do after surgery is we'll just put in little tiny nasal tampons, and they're basically little sponges.
A nasal tampon? That's a clever name.
They are little sponges, and we actually use these with little straws through them so you can get a little air through it when they're in your nose. And they only stay in for a day or two, and then we pull those out. Sometimes we'll use a little bit of dissolvable packing up in the sinuses, and we can use those just right in this area here. And that will dissolve with just irrigation. And from time to time, they'll come back into the office. We'll take a little camera, we'll go in with a camera, and whatever's there we can take out with a suction. After you've had surgery, that doesn't mean you won't ever get infected. What it means is we've opened the tract up, and if you do, for whatever reason, the mucus isn't coming out, we can usually go in there and suck it out, or we have people use the hypertonic saline and just wash it out.
Well, it's very clear to me these delicate sinuses are very important, and when things go wrong with them, there's lots of solutions. Dr. Lopatin, thank you so much for being on Champions of Care today and teaching us about sinus treatment issues. Thanks for being here.
You're so welcome.
You can find Dr. Lopatin and his phone number and how to contact him by visiting oakwood.org.